Hi, good morning. My name is Shaina Sabak, BSN 1B, and today I'm going to be giving an oral presentation on how to assess the neurological system. This is for the objectives. So the first thing you want to do is you want to gather the equipment. The following equipment that you need are gloves, pencil, paper, cotton tip applicator, paper clip, pen light, sterile cotton ball, substance to smell, taste, tongue blade, tuning fork, tape measure, cotton balls, and you just want to prepare the equipment. So after you have all the equipment, you want to demonstrate your courtesy to the patient. You want to introduce yourself, and you want to explain the procedure to the patient. After that, you want to do your hand hygiene, and provide the patient privacy so that the patient can change into his or her gown. Now we're going to move on to the mental status. What you want to do is you want to assess the patient's level of consciousness, his appearance, behavior, his mood, his feelings, expressions, thoughts, and perceptions, and the patient's cognitive ability. You do this by not having the patient be aware that you are doing this assessment, but you're gonna be asking him questions, see how he reacts, the way he responds, and the way that he answers to questions. And then you want to test the cranial nerves. You want to assess the CN1 olfactory. Before testing the nerve function, you want to ensure the patency of each nostril by occluding in turn and asking the patient to sniff. Once patency is established, you want to ask the patient to close his eyes and include one nostril and hold aromatic substance such as soap, coffee beneath the nose. You want to ask the patient to identify the substance and then repeat it with the other nostril. And then you want to test the C, the central nerve V, trigeminal. You want to test the motor function. By doing that, you want to ask the client to clench his teeth. As he clenches teeth, while you palpate contraction of the temporal and masseter muscles for contraction. So then you want to test for the sensory function. You want to ask the client or patient to close his eyes, then her or forehead, cheeks, and chin with the sharp or dull side of a paper clip. You want to touch it like that. Then you want to tell the client if she feels a sharp or dull sensation or any type of sensation on the face. Then you want to tell the client that, and then you want to repeat the test for light touch with a cotton wisp. Do it with the same areas. Then document what the patient feels. Then you want to test or assess the CN, the facial nerves. So first you want to do is you want to ask the patient to perform the following movements. Smile, frown, wrinkle the forehead, show your teeth, puff out your cheeks, purse your lips, raise eyebrows, or close eyes tightly with resistance. What you want to do is have the patient do facial movements so that you can test for motor function. Then you want to test sensory function again, which is the taste. First you want to do is you want to have the patient taste things, which either sweet, sour, salty, bitter, or umami. You want to moisten the applicator in salt and different types of substances just to test if the patient can taste something. Then you want to assess the glossopharyngeal and the vagus. You want to ask the client or patient to open the mouth wide and say ah, while you use your tongue to press on the client's tongue. So you want to see if the patient has something like a gag reflex or something. And then now we're testing for the gag reflex by touching the posterior pharynx with the tongue depressor. You want to see if the patient gags or not. And then you want to check the patient's ability to swallow. You want to give the patient a drink of water and also note the client's voice quality while after drinking the water. Then you want to assess the spinal accessory. You want to ask the client to shrug the shoulders upward against resistance to assess the trapezius muscle. So you want to have the patient, while holding down, you want to have the patient shrug. Then you want to ask the patient to turn his or her head against resistance, first to the right and then to the left, to assess sternocleidomastoid muscle. And now we're on to the motor and cerebellar system. You want to assess the condition and movement of muscles. You want to assess the size, symmetry of all muscle groups. So you just want to you want to observe the patient's muscles and arms and the muscles and how they can move. Then you want to assess the strength. You want to have the patient grip on something heavy or your index finger, ask them to squeeze so that you can see how good their grip is. And then after that, you want to have your lower extremities, where you have your client raise their leg against your hand as you apply resistance. So you have the leg here, you're putting resistance, and have the patient put the leg up. And then muscle tone. You want to inspect and palpate the muscle mass of the patient. And then you want to evaluate gait and balance. You want to ask the client to walk naturally across the room and note the posture. And you want to have the patient have free movement. You want to see if the patient is slouchy, can stand up straight, is he limping or something. And then after that, you want the patient to stride from a length of 12 to 14 inches with each strap or base of support. Then you want to go for the balance. You want to ask the client to walk heel to toe fashion and then document. Then you want to ask the client to walk on the heels and then on toes. Stand close by in case the client loses balance. And then you want to ask the client to stand on one foot and do a deep knee bend. You want to see if the patient has balance. And then you can ask the patient to hop on one foot and on the other foot. And then after that, you should assess coordination, the accuracy of movement. You want to ask the patient to extend and hold arms out to the side with the eyes open, and then touch the tip of the nose with the first right index finger, then with left index finger. And you want to repeat this 3 times. And then you want to assess the rapid alternating movements. You want to have the client perform finger thumb position and to increase speed as they progress. Then you want to ask the client to pat tie with one alternating with supination and pronation, then with speed increasing. Then you want to perform the heel to shin test. You want to ask the client to lie down in a supine position and to the side of the heel and slide the heel of the right foot down to the left shin, so like that. And you want to repeat, and then you want to document if the patient is able to do so. And then on to the sensory system. You want to assess for light touch senses. You want to get a wisp. Ask the patient to close both eyes and then try to touch with a light stimulus such as a cotton swab or a wisp on several locations, and ask them if they can feel any light sensations. And then when it comes to pain sensations, you want to use like a safety pin or something sharp if the patient can feel any type of pokiness or pain. And then you want to assess for temperature sensations. You want to apply hot or cold packets on the patient's skin, or if they can feel the sensation of the temperature. And then you want to test vibratory sensations by using a tuning fork. You can like tap it, vibrate, and ask them if they can feel any vibrations. And then you want to do the test position sensations, the kinesthetic. You want to determine the client's ability to perceive movements. You want to see if the client can see or observe any or feel anything moving. And then you want to test the tactical discrimination, the fine touch. You want to assess for stereognosis. And for that one, you're going to see the client's going to have his eyes closed, and you want to place a familiar object such as a coin. and you want to test if the patient can sense that one or know what it is. And then you want to have a test point of localization. You want to briefly touch the patient to identify the point touched. So you touch the patient here, ask him, what's this? Do you know what I'm pointing at? Then you want to test for graphesthesia. You want to have the patient's eyes closed. You want to use a blunt instrument to write a number on client's hand. So example, you have like a wand, and they example draw number 7 like this, have the patient's eyes closed, and then you want to ask the patient if he is able to identify the number. And then you want to assess for 2-point discrimination. You want to determine the fingertips all over the body and measure the distance of 2 points. Then you want to test for sensory extinction. You want to simultaneously touch both sides of the patient's body at the same point. Then you want to ask the client to point to where he or she was touched. Then we're going to move on to the deep tendon reflex. You want to see for the bicep reflex. You want to test the tricep reflex. You want to test for the brachioradialis reflex, the patellar reflex, Achilles reflex, test for ankle clonus. And you're doing this by using a hammer, a knee hammer, a soft one. And also you can have the patient ask the patient to move or do these reflexes. And then now we're going to move on to the superficial reflexes. You have the plantar reflex, where you're going to stroke the lateral aspect of the sole and see if the patient can feel any tickle sensation. And then the abdominal reflex, where you're going to lightly stroke the abdomen on each side and see any tickle sensation, if it will move up, if it will move towards, or anything. And then you're going to test for meningeal irritation or inflammation. This is for the Brudzinski sign. You want to have the client lie in a supine position with his or her head flexed to his chest. You want to have the flexion of the hips. Seeing the flexion of the hips is a positive sign of meningitis. Then, for the Koenig sign, you want to have the client lie in a supine position, flex his leg at both hip and knee. So, the contraction and pain on the hamstring muscles and resistance to extension are positive signs of meningitis. So, you're doing these signs or tests just to see if he has meningitis. So, that is all for assessing the neurological system.